Well, good evening, everybody. Welcome to the March meeting of the Montgomery County Civic Federation. We have an exciting program for this evening. We have to take care of some official business before we proceed with our special guest. I'm really very excited that Dr. Gayles is with us this evening. The first order of business is to approve the meeting agenda. Is there a motion to approve the meeting agenda? Is there a motion to?
So moved.
It's been first and seconded. All those in favor say aye.
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 Okay,
Most of you are muted. When we have voice votes, you will have to unmute yourself and then please mute yourself and mute yourself again immediately unless you're talking, please.
thank you, Jackie. The second order of business is to approve the minutes from the February general meeting, which were printed in the March newsletter on page 28. Is there a motion to approve the minutes from the February general meeting? Is there a motion?
So
to
moved.
approve?
Second.
It's been first and second, and all those in favor say aye.
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 Thank you very much. The next item on the agenda is the treasurer's report. Our treasurer, Jerry Garson, will present the treasurer's report.
We operate on a fiscal year from July 1st through next June 30th. So we're basically at about 8 months worth of data. In the last 30 days, we've received $320 of membership dues, and we've had no expenses in the last 30 days. Our cumulative expenses, revenues for the year is $1,401, and our expenses add up to $830. Our current bank balance is $9,819. If anyone has any questions, please let me know.
Thank you very much, Jerry. I had asked Dr. Gayles to start at 7:45, but maybe we can get him to start a little bit earlier. But we do have a place on the agenda for our announcements. Does anybody have any brief announcements, very brief announcements for our guest this evening? Could be about anything. Well, I can fill up time to 7:45, but let me ask Dr. Gayles, are you prepared to start your presentation now?
Yes, I'm ready to go. Yeah.
Thank you, Dr. Gayles, for joining us. Ladies and gentlemen, we're so honored and privileged to have Montgomery County's Public Health Officer, Dr. Travis Gayles. For those of us who have been following the course of the pandemic as it affects Montgomery County since last March, you know that Dr. Gayles has been working 24/7 to make our community a healthier and safer community. He does dozens of these community engagements throughout the week. He's constantly meeting with the county executive, the county council, and his public health counterparts in surrounding counties and in the District of Columbia. We couldn't be happier to have him here to give us an update of where we stand with regard to COVID-19, and maybe he can make some suggestions about what we can do as neighborhood representatives to make the community safer. So Dr. Gayles, without further ado, welcome and thank you so much for joining us this evening.
Here we go. All right. Good evening, everybody. Thank you, Alan, for the introduction. Thank you for the opportunity to be with you all for a short time on your meeting. It looks like you will have a lot of important things to discuss. And as a public health person who recognizes that the world goes beyond COVID and there's lots of health related things that continue to be important, I'm excited to see the number of items on your agenda, particularly as it relates to pedestrian safety, because we know that has been something that has impacted Montgomery County disproportionately in terms of pedestrian-related accidents and pedestrian-related fatalities over the last several years. So the work continues in spite of COVID, and thank you for your continued efforts as an organization and individually within your respective neighborhoods and communities to address those particular issues. So I don't have a bunch of slides with me tonight. I figured it'd be nice to have a conversation and answer questions that you all have, since, as you referenced, all of those different briefings come with lots of reports, and they're all readily available on the county website. But a couple of larger themes as it relates to COVID. And as it may surprise you, I'm not going to start talking about vaccines. I'm actually going to talk about something else first. And so the first thing I'd like to say is, as you all may have noticed, we have seen improvements in COVID-related numbers in our community. We saw significant improvements over the earlier to mid parts of February. Those numbers have plateaued some. So we're sitting at somewhere between 95 and 110 cases a day, as well as our hospitalization numbers have stabilized and plateaued as well. So while we have seen improvements, we haven't seen the continued improvements that we obviously would hope to see to get to lower levels where we were last summer, where we introduced the concept of reopening more extensively throughout the community. Now, there are a couple of reasons why we have, there's a couple of reasons why we remain optimistic, and there are a couple of reasons why we remain cautious. I'll start with the optimistic pieces first. The optimistic piece, which I'll get to in a second in more detail, is the fact that now we have vaccines available, which we did not have available last summer. And the vaccines have been extremely important in terms of adding a significant layer of protection to our most vulnerable residents within our community. Hence, we started with the approach that has been taken is to provide vaccines to those over certain ages, because we know over certain ages, when we look at particularly COVID-related severity of disease, as well as COVID-related fatalities, they've disproportionately impacted individuals of older age groups. We also know that it has been tied to your potential of exposure based upon the type of job that you do. And hence, those earlier categories in terms of prioritization have been focused on different types of occupations that carry a greater risk of potentially coming into contact with COVID and developing the disease and illness. And so that is optimistic, and that has given us a sense of reframing how we look at numbers in the context of vaccines. Now, on the flip side, one of the things that is also different is back then we were looking at a novel strain of COVID-19. Now we're looking at the presence of variant strains of COVID. Particularly, there's a couple of different variations. There's the UK variant, there's the South African variant, and there's the Brazilian variant. And we are actually one of two states, Florida being the other one, that has actually seen cases of all three of the variants within the state. Not necessarily in Montgomery County, but within the state. And so we are waiting to get a sense of what will be the impact of those variant strains before we move forward, because those strains are more contagious and easier spread than the novel strain from last year. So I say all that to say that we're going to continue to monitor our trends and take cautious steps in terms of moving forward with reopening with the guidance of the CDC, the federal government, and our state. So to pivot from that, we continue to test at higher rates and levels than any other jurisdiction across the state and the region. And our test positivity is coming down and improved significantly, which is helpful. We do need folks to continue to get tested in spite of the fact that we do have vaccines available, because we obviously don't want to miss cases, and certainly in the setting of new variant strains. And so the third piece of that is to move over into this topic that most people want to talk about these days, is vaccination. We do now have 3 candidates that have been successfully approved by the Food and Drug Administration and the federal government and have been distributed. We've actually distributed doses from Pfizer and Moderna since December, and those are 2-dose regimens. And this week we began administering doses from the Johnson & Johnson package, which is just a 1-dose vaccine. All of them are viable candidates and offer protection. They are 100% effective against preventing COVID-related fatalities, and in the high 80s and 90% of presenting severe illness secondary to contracting COVID, as well as hospitalizations. And we get our source of vaccines directly from the state. And if you've been paying attention at all, there's been a little bit of back and forth and battle with the state related to those allocations because we have felt that we could be getting more, we should be getting more. And whether we're talking about a mass vaccination site or just simply having more doses sent to the county to recognize that we are the largest jurisdiction in the state, as well as we have been one of the jurisdictions that has been hit hardest in terms of number of cases as well. So we continue to fight those battles and continue to advocate on the behalf of our residents. And in the meantime, we continue to offer vaccines through our county sites. There are other vendors throughout the county who provide vaccines, including our hospitals and health systems, as well as a number of retail pharmacies, as well as there are a number of mass vaccination sites throughout the state that our residents can take advantage of. So while we continue to do that, we have moved through our prioritization groups where we are in alignment with the state at this point, with one key exception. We as the county and our county sites are providing vaccines for individuals in the 1A, 1B, and the 1C piece category, that is individuals over the age of 65. So I reference our county website that has the prioritization framework in place. And let me be clear, the reason why we are doing that is because we don't have enough vaccines to go around. And so we have, out of an abundance of necessity to do that, we created a prioritization framework to move forward. So I will stop there and open up the floor for any questions that you all may have. Again, those are our larger 30,000 foot view topics, if you will. We also continue to provide guidance to businesses or schools and a number of other entities as it relates to opening things back up, returning to school, returning to work, returning to play, those kinds of things. Thank you.
Thank you, Dr. Gayles. I see Bailey, do you have a question?
I do. Dr. Gayles, do you have any greater definition as to when the good governor is going to increase supply to Montgomery County significantly?
Thank you, Bailey. That is an excellent question. I wish I had a better answer for you other than we continue to hope that that will increase each week. We have, in our advocacy to the governor, we have asked for a number of things. We have asked that the doses sent to Montgomery County per capita match up with everyone else. There's an interesting article in the Baltimore Sun today that was published that showed that the larger counties actually received a smaller amount of vaccines per capita than other counties throughout the state. So that's the first thing we're asking, is our fair share. The second is that in the distribution of that fair share is that there be some consideration for providing more doses to the health department to be able to support community partners. There was a shift in how the doses were sent out probably about a month or so ago, where more doses were sent to retail pharmacies throughout the county as opposed to the health department. We don't have any opportunity to kind of have any say in terms of how those doses are distributed or in terms of having accountability, because we know folks have called and they don't get their calls returned. That's a different level of accountability that we have as the county government in terms of being responsive. So that's the second thing we've been advocating for. The third component that we've been advocating for is more doses potentially through a mass vaccination site, similar to what's been set up in other parts of the state. Our concern is that, yes, we make up just shy of 20% of the population, and by virtue of population, it would make sense to have one of those sites here within the county. Particularly also from a regional perspective, we've pushed it an approach to say a large mass vac site here, because currently there is no mass vaccination site west of 95. So there are 2 in Baltimore, 1 in Prince George's County, and the next 3 that are being set up are in Charles County and 2 on the Eastern Shore.
Wow.
And so that's where things stand now. We've advocated to have one here, which could also increase access for Frederick, Carroll County, Washington County. I do believe they are in talks of having one in the Hagerstown area, but that would again be after all of these others that have been put up. So I say all that to say that those are the different layers where we're advocating to increase doses to the county, not just again through a mass vac site, but across the board in those different areas. We push it every day. And at this point, we don't have a commitment for the mass vac site. We have received a little bit more conversation and interest from the state, but again, there's no commitment to do that. We have been moving forward in terms of identifying a site for that and setting up that site to be able to move forward if we were to get more doses.
Everybody, we're going to ask Jackie to be the moderator. Jackie, please.
Okay. Carrie Lamari, yours is the first question up, and there are 3 hands raised after you. Unmute yourself, please.
Hi, this is Jerry Garson. One of my questions is I've been analyzing the data of doses received per covidvax.maryland.gov and what CDC reported doses to Maryland is getting. My question is, why does CDC report an additional 421,125 doses to Maryland? They report 87,025 more doses administered. They report 88,800 more first doses given and 145,540 second doses given. There's something wrong with the data. I don't understand it.
That's again an excellent question. We don't control the state data here, and I'm not trying to not answer your question, but the state would be able to give you a better definition why those numbers don't match up. What we do, so this is how the numbers are followed. We get our allocation of doses sent to us physically. We check those and monitor those, and we allot those. At any time we administer a vaccine, we have to enter that into, there's a state system called Immunet that tracks all of the doses that are administered. And so that's the numbers that we follow for what we have received and what we give out here from the county. And all of the other spaces and places where the state ships things, though, they follow that number collectively. So I would say, again, kind of to the first question that, data, to get an understanding of how those numbers match up would need to have some input from the state to be able to fully answer your question.
Okay.
Okay, Carrie, go ahead.
Thank you. Dr. Gayles, thank you for coming tonight. I have 2 questions, and I'm hoping you can help me out with them. One, I'm a little confused on people that are under 65 with underlying conditions. The state website says that, if I interpreted it right, that they can get vaccinations at state-sponsored sites, but I'm not sure if the local pharmacies are state-sponsored sites or where we could get them other than driving to Baltimore or to Six Flags. The second question deals with, I'm an electrical contractor, and I know that my local supply house had a shutdown because of a COVID infection. And that kind of makes me think, electricians go into people's homes all the time, multiple families, multiple homes that, during the course of a day. I know that I do. And if one person gets it, it seems to me he or she is going to be a problem. How can we deal with that? Or shouldn't service contractors, service people be prioritized? Because like I said, I know that if I did get COVID, I'm afraid that it could go pretty rampant. Those are my 2 questions.
Thank you, Gary, for your questions. I will try to answer them, and if I forget one, remind me of it. It's been a long day, so sometimes I don't remember the exact questions. So the first question related to, I'll answer the second one first and then go back to the first one. So the second question is, so there are a host of different, employee categories that are prioritized. And I don't dismiss the fact that all of these groups have potential exposure. We just simply don't have enough doses to go around. And so what we've tried to do is follow guidance from the CDC as well as the Committee on Immunization Practices to frame the framework in terms of prioritization. I do believe utility workers, including electrical workers, are prioritized in group 1C tier 3, which is prioritized above the general public. And we are moving, the county's site is providing doses again. As I mentioned, we're moving to be able to get there. The state, all of the other sites are open to 1A, 1B, and 1C categories. So that would include essential employees, inclusive of electrical workers and folks like that who are completing utility services that are needed in this time. So there are provisions, and you are able to get the vaccine. The challenge is there's limited supply. So a lot of the sites are retail pharmacies and other places are locked out based upon supply, or the supply goes really quickly. So there has been an effort to prioritize as much as possible throughout all of those different categories. And that actually spills over into the first question that you asked related to medical conditions being under the age of 65. Similarly, the state has opened up provisions so that, again, all of those people in 1A, 1B, and 1C, including 16 to 64-year-olds who have different medical conditions, are able to utilize all of those different sites for vaccination, including retail pharmacies, hospitals and health systems, and those large sites that you reference in terms of that some that drive to access the vaccines. We, as the county sites, have not made it that far in there. We're prioritizing the groups over 65 at this point. We moved to that at the latter part of last week. And again, it's a numbers game. So to give you some insight in terms of how many folks we're talking about, the 65 to 74 population alone in Montgomery County, I think, is somewhere over 100,000 people. And when we looked at our essential employees who fit into the 1B category, tier 2, that was somewhere between potentially 40 to 60,000 individuals within that. The county overall, including the health department, the hospitals, and the retail pharmacies, is averaging somewhere between 12,500 to 15,000 doses of vaccine a week. And so if you start to look at the numbers, you can see how they don't add up in terms of being able to get, huge groups of people in a short amount of time. So hence the prioritization system, and hence, unfortunately, being at the mercy of limited doses and limited schedules available. Now, the hope is that with the new administration that has come in, they've increased production and they've increased some programs to promote increased allocation to different jurisdictions, to the states, is that we will see that average number of 12 to 15,000 increase significantly in the near future, which would take away the longer wait times and increase opportunities for individuals like yourself and your co-workers to be able to get vaccinated quickly.
Okay, next question from Kristy Daphnis. If you would unmute yourself, please.
Yeah, I just had a quick question. I know that the Montgomery County Public Schools just partially reopened this past week and are moving to open up a little bit more over the weeks. I was just wondering how closely you're working with the school system on various mitigation measures and oversight of kind of what the classroom environment looks like and all of that.
So thank you for your question. We actually started meeting with MCPS last year, over a year ago. So we started meeting with them before we were notified of our first cases, which literally was March 5th, just a little bit over a year ago. In terms of planning for COVID, and then as the pandemic began and ramped up, we met and we continue to meet with them on a weekly basis to review the strategies that they have in place, whether it's the types of things they're putting into place in the physical footprint of their schools to keep the kids safe. Also, providing guidance on other policies, for example, recently guidance on travel related issues, related to spring break and those kinds of things.
Yeah, it seems like a mixed bag when talking to various teachers and people who are working in the schools. being left up to the principals, and it doesn't seem to be like a real consistent set of procedures. So I was just curious about that.
Well, I can't speak for how they communicate internally, but I can say their senior leadership has taken they've been very engaged and asked lots of questions, related to the guidance that they provide. Again, I'm not a part of what they do once they take the guidance and move, but I will say, Dr. Smith, Dr. McKnight, and the senior staff, again, asked lots of really great questions, and have been very thoughtful and careful in what they've put forward.
Okay, next question from Jeff Griffith. Please unmute yourself.
This is a follow-up to the teacher question. It's a simple question. Why can't we make teachers a very high priority? Let me just say that because of my age, I'm in one of the highest groups, and I've already received both of my vaccinations, which I would gladly have given up in place of a teacher. While I stay at home comfortably, the teacher could be in a classroom with 20 first graders, feeling more safe about it. And I don't quite understand why we haven't made this a higher priority within the county, which I assume is within our control.
Well, Jeff, thank you for your question. But, to be perfectly candid, we have prioritized teachers. And in fact, as of earlier this week, and this is teachers not only for public schools, but non-public schools as well, we had offered vaccine opportunities to approximately 20,000 of the 25,000 teachers, the public school teachers, and we anticipate by probably hopefully the end of the week, we will have been able to provide an invitation to be covered to all of them. And similar to the numbers, I don't have the numbers exactly for the non-public schools, but we share your concerns. And, I'll say perfectly, to be candid, my mother was in the classroom up until last year. And so I'm very worried about teacher exposures. Now she could retire, and she did choose to retire, thankfully, which saved me a lot of headache. But to your point, we have attempted to, working with, we didn't form a partnership per se, but working with our colleagues at Johns Hopkins and Suburban to offer doses. And what we had done with the education staff is at the beginning of January, we'd asked them to prioritize their staff in terms of who would be going back first, because we knew we had a limited supply. So we have been moving based upon, the reopening strategy. Everybody who was in phase 1 got the first set of invitations, and then we've been moving through that way. And again, hopefully by the end of the week, everyone who, I think actually all of that group, their educators and staff, will have received an invitation to get the vaccine.
Okay, next question, Sue Schumacher. Please unmute yourself.
Here, can you hear me now?
Yes, we hear you now.
Okay, I got notice. I should have been in the next group after the emergency people because I'm 77 and I have cancer. I finally was invited to go in Howard County, the Johns Hopkins Applied Physics Lab. It's a good 40-minute drive from Bethesda. It was either there or actually going to downtown Baltimore to Johns Hopkins Hospital itself. This is ridiculous. And I was there for my shot at 8:30 in the morning, and I asked if my companion who brought me could get his shot, and they said if you were at the end of the day, probably, but you're the beginning, and we got to make sure that they last to the end of the day. That's it. By the way, it was empty and it's huge and it's beautiful.
Well, Sue, thank you for your comment. I'm glad that you were able to get a vaccine. Over the last couple of weeks, if you pre-registered in the county system, we've been sending out links to everybody who is in the 75 and up age group. And we double back with that to make sure everybody received a link. I'm glad you did. If your companion is still looking for a vaccine and they meet the criteria, please have them complete the pre-registration process for the county system so that we'll have their information to be able to reach out and provide a link to them.
He works at the State House. Don't worry about him.
Okay. Well, I hope he gets it one way or the other.
Okay, thank you.
I've got a question, Jackie. Dr. Gayles, I, like probably millions of other people, were happy when the CDC came out with its new guidance today. I'm wondering what does that mean in practice? For example, the people who get the one-shot J&J vaccine, how soon after they get the vaccine will they be able to meet with other similarly vaccinated people? And does it mean that for the people who get Johnson & Johnson and Moderna, will they have to wait the same length before they can gather with people who've also been vaccinated?
Well, that's a great point. And I think there are lots of questions that are becoming of is the point, because the key is, at what point do I have the maximum protection? And just as an example, so for the Moderna and the Pfizer vaccines, it's speculated that you get your maximum protection 2 weeks after your second dose. And for the Johnson & Johnson one, you get it 2 weeks after your only dose within that. And so I think those are kind of the timeframes that, obviously people are going to have different levels of activity once they get one dose or two doses. And I received my second dose last month, so I've been covered for a while. But my parents will actually be receiving their second dose of the Moderna vaccine this week. I know it may be a little bit early, but I can't wait to see them. So I'm going to see them this weekend because I haven't seen them in a really long time. So I think it's within that window that, we would recommend folks to, wait after you get your complete series, whether it's the one dose for Johnson & Johnson or the two doses of the other two, to allow your system to get to that maximum level of protection before starting to, go into spaces where you might not have on a face covering, if you're around other folks who've been vaccinated as well. Just to be safe.
Thank
I
you.
believe the CDC said 2 weeks after the second dose, right?
That's what I just said. Yeah. So for the maximum protection, 2 weeks after the second dose.
Jackie?
Yeah, Dean Ahmad, you had a question? Please unmute yourself.
Yes, thank you. Thank you for being with us, Dr. Gayles. I wanted a clarification on the situation with the retailers. And thought I heard you use the word independent as regards their distribution of the vaccine. But when I was in my CVS the last week, a staffer asked me if I'd gotten my shot yet. I said, no, I was on the pre-registration list and waiting for somebody to get back to me. I said, was it possible to get one, separately there? And they said, no. So what does it mean when you say they're set, they're independent? Do we still have to do it through the pre-registration program? We still go through Montgomery County. Is that right, or am I wrong?
So the pharmacy system is completely outside of our purview. We have no authority or input in terms of the doses that they're getting and how they're being distributed. So the pre-registration list that we've created as the county is for the county sites. And we have also, to some degree, shared some of those with our hospital partners who created clinics and said, hey, we want to provide outreach to folks. And we've worked with them on that. We are working to create an opportunity where we can meet with the leadership of those pharmacies to help align them with what we're doing as a county and make sure we have a full understanding of what they're doing. But the way the state has set it up is the state contacts them directly and provides doses to them directly that's separate from what we're doing as the health department or any of the government related distribution sites.
Karen Corder, you had a question.
Yes, it was a pretty simple question. I did manage to get a shot somewhere else, but I am on the county's pre-registration list, and I actually thankfully did just get a notice saying, oh, I could come and take my shot through the county. How do I get myself off the list so I'm not clogging up your works there? How do we unregister?
Well, you would inevitably unregister yourself by not responding and taking the appointment also, so that piece, yes. But you can also, if you respond to that very same email and say, I've received the vaccine elsewhere, it'll go back to the team and then they can remove your name off the list.
Okay, because the email actually said, don't respond to this email, I think, so.
Well,
that's what I
it should be, it's C19 vaccinations@montgomerycountymd.gov.
Okay, and just for anybody else, if you didn't respond once, if you just happen to see that one, do you get taken off right away, or do you get a couple of shots before you get dropped off the list?
No, so you're kept in the system. So for example, I think it was Sue who asked the question about 75 and up. We keep a list, and then, you know, as we're moving from one phase to the next phase, or one priority group to the next priority group, we're not waiting for 100% of people to be covered before we do it. But what we're trying to do is to give everybody at least the opportunity to register for an appointment before we move forward. So what we did then is we said, okay, here are the names of the people who pre-registered that who haven't physically gotten it per our records. Let's send them one last email, you know, to see if they need to get in. And if what we found is a lot of folks had gone somewhere else, or, you know, because we've gotten, I think we're close to over 80% of the 75 and up group covered. So we've got really good coverage there. So yeah, that's how it would work. I'm glad you got an opportunity to get
I'm
a shot.
glad I got one shot.
Glad
Wait
you got
for
a
the
shot.
second
There we
one.
go.
I can go see my great nephew in a month or so. And
Yes.
Dr. Gayles, I have another question. What's your plan for outreach to communities of color? People have been talking about mobile med vans and things like that.
Mhm.
I've seen recently on television, you did some stuff in East County, but what's your plan for outreaching to these hard to serve communities?
So there's actually an extensive plan in place that's been working in the background, and will be ramped up even more. It's a collective partnership with our Office of Community Partnerships, our Minority Health Initiatives and Program, Department of Health and Human Services. And so that includes focused outreach campaigns through print and social media. As well as they have bought, and I can attest to this, I saw it last night and had to laugh. We were watching TV on, I don't know if it was Hulu or one of the those type services. And during the commercial break, there was a county commercial talking about go to Montgomery County COVID channel, and here's this website, and you can watch it. So there's been an investment in terms of outreach that way. There also, what we've tried to do is create those venues, such as the East County opportunity. We have been partnering with different groups. For example, we had a pop-up clinic with our colleagues at the Pan Asian Clinic a couple of weeks ago to stand that up. And we've been looking at other opportunities where we can partner to do those types of things to create spaces and opportunities for the vaccine, but also be very careful and cautious about how we remove those obstacles and barriers to getting the vaccine. So we've been partnering, we're doing a pilot right now for mobile vaccine distribution. It's particularly focused on homebound folks right now, but it is a model that we would likely be able to scale up and provide other services to different groups to, again, increase penetration within communities. The other thing that we are hopeful for is when there's an increase in the doses that are provided, is not just to support large systems, but to also then be able to have doses provided to community providers and increase the network of places where people have access. And so the county is not just the only, there will be more opportunities for people to get the vaccine, and we can focus our resources to capturing those folks who may be blocked and locked out of the system otherwise.
Bailey, you have a question?
Yes. So if you're one of the people who is at the bottom of the list, it doesn't make any sense to start pestering people about getting an appointment now. So what is your best guess as to when the last group might be able to get appointments?
Well, that is all contingent upon the production cycle. I know President Biden recently said everyone who wants a vaccine will have access by the end of May. And so a lot of it just depends on, we're really at the mercy of the doses that are provided to us. Now, certainly the production and the allocation of doses has to increase significantly if we want to get to that point. You know, our allotment from the state has been stable the last month. And so until we start to see that increase, I think I'll be more optimistic. But if we hit the numbers in terms of production that the federal government has put forward, I believe that folks at the bottom of the list, if you will, or just the general public, will have access to the vaccine sometime early summer.
So a quick follow-up, the bottleneck, from everything that I've heard and read, the bottleneck seems to be the state government, the state governor's office. Do you have confidence that, so what I heard last week was that Montgomery County was getting 8,000 doses a week. Is that scheduled? Do you anticipate that's going to triple or quadruple anytime soon?
We hope so. I mean, we've been told that capacity will increase over the last several weeks, and we haven't seen it yet. So there are two levels of bottlenecks. So the main bottleneck is from the manufacturer level, the federal level, that's then allocated to states. So states are working with a fixed supply of doses that they have to provide to local jurisdictions. Now, so that is a bottleneck. Now, for the first 6 weeks or so of the pandemic, Maryland as a state was getting 72,000 doses on average. Now, over the last couple of weeks, that number has increased to, I think last week, the state received over 100,000 doses. Now, the second bottleneck is from the state to local jurisdictions and how those doses are distributed. So in the setting of increased doses supplied to the state has shifted those doses to support the mass vaccination sites and more to retail pharmacies as opposed to local health departments and health systems. And so that is a separate bottleneck there, because again, if you follow in the news, there is this tension to understand how the state's making those allocations and to be able to support more of the local-led efforts and initiatives that are built upon those community partnerships to be able to do things like the last question is, have more community pop-ups and support those ideas. We'd love to do more, but we're limited by the number of doses that we get from the state. So there's a couple of bottlenecks there that creates that tension on the system.
Dr. Gayles, there was a question in the chat about the zip code area 20903, which crosses the county line, and it's a lower income zip code. And is there going to be some outreach to that area? Are you familiar with it?
Yes, so there's outreach already going on there. So there's outreach in all those different ways that I mentioned. And then when we look at the allocation of doses, we have been looking at those zip codes that have been hit hardest throughout the pandemic and over the last 90 days in terms of cases and fatalities, and are working to try to allocate doses to those places to make sure that they have an opportunity and are included in that.
I think our last question then is from Kristy Daphnis again. You ready, Kristy?
Sorry, I had to find my unmute button. I just had a quick question. Now that there's the Johnson & Johnson vaccine coming online, which doesn't require a lot of extra freezer requirements and stuff like that. Following on to the question about communities of color, has there been any talk of putting some clinics in some of the community health centers that are based out of schools through linkages to learning?
Not at this time. We have been building a network of community clinics in other areas. That certainly is an opportunity to look at, but that's not been as part of kind of the first priority line since those spaces have been closed for some time. Now the challenge with the Johnson & Johnson doses are, unfortunately, so we got a wave of doses last week. And so the federal government cleaned house. They sent out every dose they had to everybody. And so we got 1,600 here, and we've already used, I think, 1,300 of ours. and we're using the rest this week to do some at our homeless shelters to provide doses there in a number of places. But we're not actually going to get any more of those for another 2 weeks because they've got to resupply what they have. But you're right, increased supply across the board does open up more opportunities to do some creative things like you mentioned. And that's what we're excited about is, so what we're doing behind the scenes is building that infrastructure so that when the doses come, let's say the state calls tomorrow and say, Travis, we got 50,000 doses for you. We've got a network that we can put them out. Now we know, unfortunately, that's not going to happen. So don't everybody get excited. But we want to be able to, when the supply increases significantly, we want to have the infrastructure in place already so we can hit the ground running. And, you know, whether it's Kristy or Alan or Bailey or whomever, you can get a dose fairly quickly and not have to wait as long as we've had up front right now.
Well, thank you, Dr. Gayles, for joining us this evening. It's been enormously useful. I know that everybody was totally engaged. We will be recommending people go to your website where there's lots of information, the data dashboard, and lots of information about testing and vaccines. Thank you. I know how busy your time is, so thank you so much for joining us this evening.
Thank you for the opportunity. Thank you for the great questions. Please continue to stay safe, stay sane, and stay stress-free, and don't give Councilmember Glass too much of a hard time. Or actually take it out on him so then tomorrow when I have my briefing with him, he won't have any energy left to ask me any questions.
Thank you, Dr. Gayles.
Take care.
Thank you.
Well, that was wonderful. That was better than I expected. We're going to move now into our regular meeting program, and I'm excited about this. It's on the general issues of pedestrian safety and open streets, and we've got a fantastic group of subject matter experts from all across the county, starting with my friend, our friend, Councilmember at Large Evan Glass, who has recently produced a very successful town hall on pedestrian safety. Evan will lead off our conversation, to be followed by Wade Holland in the Office of the County Executive, and then Kristy Daphnis, who is the chair of the county's Pedestrian, Bicycle, and Traffic Safety Advisory Group, Alison Gillespie, who is Civic Association president. She's the president of the Forest Estates Community Association, and she's also a founder of the Open Streets Movement in Montgomery County. And last and surely not least is Peter Gray, who's a vice president of the Washington Area Bicyclist Association, very active in that space. And he is a member of the county's bicycle advisory group. He'll tell you exactly what that is. So let me ask Evan to begin by talking about some of his work, and then we'll go right to Wade, who's got some slides to share with us. Councilmember Glass.
Well, good evening, everybody. And Dr. Gayles said what I was hoping to say, in that I appreciated the conversation you all had with him, and you certainly gave me some more food for thought and questions when I speak with him before the full council tomorrow morning. And just so that for those of you that don't know, over the last number of months, we have switched up the schedule of the council so that when we start on Tuesday mornings at 9:30, the first thing on our agenda is a conversation with Dr. Gayles and Dr. Stoddart and Dr. Kroll, who runs HHS. And so it is our version of must-see TV. So I encourage you to watch that if you want to see more up-to-date information, Tuesdays at 9:30 in the morning. But that is not why we're here. We're here to talk about another important issue, one that has been affecting us for a longer period of time than COVID, and unfortunately might be here longer as well, but that's what we're trying to change. And so that is Vision Zero, and Vision Zero has been a priority of mine since I arrived at the council 2 years ago. And for those of you who've known me as an activist in the county, and in particularly the downtown Silver Spring area, it is pedestrian safety that got me into civic life and, quite frankly, local politics as well. So this is a real cause for me. And The numbers are sobering, quite frankly. In the year 2020, when for at least 9 months, many of us stayed home as often as possible, and we were not out and about in a normal life. We had some record number incidents on the roadways in the DC area. And here in Montgomery County in the year 2020, we had 18 people killed on our roadways, and more than 500 were injured. And so think about that in a year when most of us thought that we would sit in our kitchens, zooming into meetings and getting groceries and food delivered to us. We had some unfortunate record-setting numbers and incidents here in Montgomery County, and it's absolutely terrible. And just in the first 2 months or so, 2 months and a few days of this year, 2021, we have already seen some serious pedestrian collisions here in the county with 2 fatalities. And just this past Friday, there was a pedestrian fatality on Veers Mill Road. And so we are not off to a good year again. And when you look at the names of the individuals, in particular, who have been killed on our roadways here in Montgomery County, they are predominantly people of color. They are Black and Latino individuals here in Montgomery County, and they are walking and carrying on with their lives in parts of the county, which quite frankly, if you looked at a map as to where COVID was greatest, you would see a very strong correlation in our communities of color. And it just speaks to the equity issues that we have here and the need that we need to do a better job of making sure that all of our communities feel safe and healthy. And so that is a bigger conversation than just this, but the maps don't lie and the data don't lie. And while we've made some progress over the last number of years since our Vision Zero initiative was started, there's a 32-point goal that we want to achieve, and I'm sure Wade Holland will get to some of this during his presentation, but the fact is that we have a lot more to do. And as Alan mentioned, I hosted a town hall back in January, and we had about 300 people attend on a Saturday morning to talk about this issue. And I really appreciate it. I see some of you here were part of that conversation, and it was a really good conversation. People were able to get off their chest some of the frustrations, some of the concerns. They were shared with me, areas that we as a county should be looking at, intersections and sidewalks that need some improvement. So I'll just throw this out there right now. If there are areas in your particular neighborhood, please don't hesitate to reach out to me. Sean Emerson from my office is on this Zoom. He can put his email and our office email in the chat box, but please do stay in touch. And it was because of that conversation at that town hall, recognizing the need that continues, that I recently, I think 2 weeks ago, introduced a piece of legislation called the Shovel Our Sidewalks Act. And what that bill, and you all are an engaged and learned group, it is actually Bill 921 that was just introduced. And the goal of that legislation is to ensure that narrow sidewalks on busy roads, many of them are state highways, that they receive the attention of our Department of Transportation and get shoveled. And to be even more specific about it, they are sidewalks in our equity emphasis areas. And those are essentially census tracts designated by the Council of Governments for areas where we have a higher population of people of color and lower income. And I tweeted out a map a few weeks ago. I can share that with you as well, but it's from the Council of Government, so you can Google that and see that as well. The county already shovels about 60 miles of roadway here in Montgomery County, and this would add a few miles more. But the important thing is to recognize that these are in the equity emphasis areas, because we know that during this pandemic, there are a number of essential employees and workers who could not work from home. Their jobs wouldn't allow it. And even if their jobs allowed it, they might not even have the connectivity to fulfill it. But they're walking, down state roads to get to their buses, to get to work. And so often they have to figure out if they want to trudge through the sidewalk with the snow or take a risk of going into the sidewalk, going into the street to walk around that snow that has been piled up there, putting their own lives at risk and putting the lives of the drivers at risk as well. And we don't want people to have to choose. And so that's why I've introduced this piece of legislation. If it is something that you support, particularly from the Pedestrian Safety Act avenue, the Equity Avenue, and the Vision Zero Avenue, I encourage you to write to my colleagues as well. But that public hearing is going to be on March 16th. So it's coming up. And again, you can reach out to me or Sean Emerson if you have any questions about that piece of legislation or would like to provide any words of support. And so I know that there are a lot of other speakers, so I'm going to stop there, but appreciate all of your engagement and everything that you all do here in Montgomery County to make it an even better place to live, work, and play.
Thank you so much, Councilmember Glass. It's good to have you. It's good to see you. Remember the good work you do, starting the South Silver Spring Neighborhoods Association. So you're definitely part of the flock. Let's turn the program over to Wade Holland. He's the Vision Zero coordinator in the Office of the County Executive. Wade, are you ready to go?
All right, well, good evening, everyone. Thank you, Alan, for putting this together and having this great panel together to talk about pedestrian safety and Vision Zero, because as we talk about Vision Zero, it's not just pedestrian safety. We talk about bicyclist safety as well as people using assisted mobility devices and just getting around in cars, scooters, however you want to get around. We want to make sure you're safe. So before we get into the quick slide deck where we give you some updates on projects and campaigns that are going on in the county, I do want to thank the Civic Federation for sending your consolidated comments from last summer. I'd sent a letter to Alan and the rest of the Civic Federation about their priorities for Vision Zero going forward. And I really want to thank you for going, not only responding, but really going above and beyond and surveying others, the actual civic groups under your umbrella and consolidating all those results. That was great feedback for us. So what we did with all that feedback that we collected last summer and last fall is we presented that to our work groups who are currently working on the 10-year plan. And I'll talk a little bit about that in my update. No shockers, no spoilers really in terms of what was prioritized from the Civic Federation notes as well as the other community groups notes. More sidewalks, better sidewalks, including, as Councilmember Glass mentioned, clearing the sidewalks from snow when there's snow on the ground, new and better bike lanes, and improved lighting were some of the things that came up in our community surveys. Were also things that were mentioned in the Civic Federation's letters as well. So with that, I'll give you a quick update on the some of the projects we were working on and what's coming up in the pipeline for Vision Zero, and then I'll turn it over to Kristy to talk about PBTSAC. So 1 second while I get my screen up. Looks like I need to get permission to screen share.
Okay, share screen. That's not it. That's not it either. Let's say try it now, Wade.
Success. Thanks, Alan. All right, let's make sure I actually show the correct thing. All right, the universal question of COVID times. Can you see my presentation?
Yes.
Yes,
All
sir.
right, great. All right. So again, we'll start with quickly, was talking about what we've been completed during COVID, what's been going on during COVID, and talk about what's kind of coming up in the next couple of months in 2021. So one thing we're working on a lot with between MCDOT, the county DOT, and the state highway administration is really making some improvements in the Wheaton Triangle. So you think about Veers Mill, Georgia, and University in the downtown area there. trying to make sure the roads there are safe for everyone, because, you know, over time, as Wheaton was built, it was really built to get people in and through Wheaton as fast as possible. It wasn't really built for the residents who were walking, shopping, living, and dining in those areas. So you can see on this map 13 different things we've improved in that area in the last year or so. The biggest one has been lowered speed limits. So all the speed limits on the major roadways there have been lowered to 25 miles an hour inside of the triangle. And to help keep this vehicle speeds lower, we've also done some treatments along the roadways. So the travel lanes have been narrowed. So basically, if you have a 10-foot travel lane versus an 11-foot travel lane, makes you feel like you're a little tighter and makes you want to kind of go a little slower, keep watching your speed. We know this works because we got some feedback in DOT that said, I feel like I have to drive defensively through Wheaton. And we're like, great, thanks for the feedback. That really helps us know it's working. We also added some on-street parking on George Avenue during off-peak hours that allows, you know, kind of takes those travel lanes away. So when there's less capacity need, it adds some buffer space and makes you want to feel you drive a little slower with that turnover parking. There's also some other things that are still in the works. So at George and Reedy, we're looking at some signal changes there. They'll add a lead pedestrian interval. So lead pedestrian interval is where the pedestrian will get a couple second head start before the vehicles can enter the intersection. We're also looking to, will be installing a full traffic signal at Georgia Avenue and Price Avenue. So that's kind of the area in between Reedy and University Boulevard. So that will make that intersection fully protected, and we'll have a signal and a crossing for pedestrians in those areas. Another area that we've been doing a lot of work in the last couple of years has been around Seneca Valley High School. So for those who are not familiar, this area is, the school has been completely rebuilt, and it's gonna be one of the largest, I think by square foot schools in the state of Maryland. So working with the community up there, working with some of the PTA members and some of the other pedestrian advocates in the area to make some improvements in those areas. So Middlebrook Road has undergone what we call a road diet, where some of the general travel lanes have been repurposed to improve pedestrian and bicycle safety. So you can see on the left here, you can see that a travel lane on the side that faces the high school, that lane has been completely converted into a bike lane, a two-way cycle track. Other smaller improvements we made in there have been a new signal at Wisteria and Crystal Rock Drive. We've also made changes to the signals to help pedestrians cross a little easier. And of course, the smaller but important stuff in terms of ADA ramps and upgrades and crosswalks and aligning crosswalks across the way. Obviously, doing any sort of outreach during socially distant times is a little tough, but we have been able to do some activities, virtual and in person during COVID. So on the left of the screen, you'll see we are socially distant bike rodeos and courses. We were able to do a couple of those in the fall throughout the county. So you can see the students were kind of all spread out using the bike course, being outdoors. We also sponsored in last May a virtual safety week. So every day was different activities for kids. And you see in the bottom right there, picture of 2 kids doing their activities there. I will mention here too, with kids going back to school, we are working very closely with MCPS's DOT to try and prioritize safe and active ways of getting to school. So we'll be putting out some more information this month about walking school buses and bike trains as a way to be socially distant, but also active for getting safely to and from schools. So during the COVID-19 pandemic, something we saw nationwide was a large increase in speeding, impairment, and people not using seatbelts that are being involved in crashes. So things that we've been working on since the COVID-19 pandemic have been focusing on impaired driving, as well as responding to complaints about motor vehicle noises. So we've had a lot of issues with street racing and modified exhaust causing a lot of disturbances for folks. So we've had joint campaigns with county police, state police, and municipal police, as well as the MDTA police that kind of patrol the ICC to do campaigns to get people off the roadway. So here you see 2 crashes involving impaired drivers that happened prior to the holidays in December. We kept our holiday task force going this year. Again, the assumption may be, well, the bars are closed, the bars are closing early, there can't be that many impaired driving incidences, but actually our numbers in terms of arrests, which were right around 262, really weren't down that much compared to previous years. And actually, when we saw our impaired driving deaths for 2020 compared to prior years, it was way higher than normal. So, if I put a bet down, I would have said, well, the bars are closed, restaurants are closed. I would assume the impaired driving deaths would have gone down this year, but it was completely the opposite. But the good news was, at least with the holiday task force, during the time that task force was running, and we did a lot of publicity through social media, press releases. We got a lot of media attention as well from just like the local news channels. We actually had no impaired driving deaths during that campaign. I'm going to skip over this, but we'll talk about this a little bit later with the group about the Shared Streets program. For those who are not familiar, that includes kind of the neighborhood greenways, which are kind of prioritizing biking and walking spaces, and the streeteries, so like downtown Bethesda and Silver Spring and Wheaton are placed, and as well as municipal partners like Tacoma Park and Rockville that have closed down some areas so that restaurants have a place to set up outdoor tables. So a quick overview of what's in the pipeline. So here's kind of a map of recently installed traffic signals and beacons. We have 3 traffic signals that are in the work. I mentioned Georgia and Georgia and Price earlier. That's going to be installed. The State Highway Administration is working on 2 signals, one at River Road and Brayburn Parkway. That's adjacent to the high school there, as well as Veers Mill Road and Norris Drive. That's a place where, again, the State Highway Administration and the County Department of Transportation are partnering on a project. So we're paying for some improvements along Veers Mill Road in terms of pedestrian beacons. And then the state is also going to put in for some traffic signals there. And then speaking of beacons, you can see that there are about 7 locations listed here where we'll be having new pedestrian hybrid beacons installed. And for those who are not familiar, the pedestrian hybrid beacons are kind of the ones that look, they have the 2 red lights on the top, and then they have the amber light below. So when the pedestrian activates it, it'll flash the amber light first, and then go to a solid red phase, and then go dark again. So those are being installed all throughout the county. I think the next one to go in, that approved for construction, is the one listed there first at Twinbrook Parkway and Twinbrook Recreation Center. For bikeway projects, a lot of activity going on, especially around the Purple Line. So for design work, there is currently projects in downtown Silver Spring with the Fenton Street cycle track, Amherst Avenue in Wheaton, Cheltenham Drive and Metropolitan Branch Trail, in the former being in Bethesda and the latter being in Silver Spring, and also connecting down to DC. Construction is currently ongoing in Bethesda. You can see the picture on your left is the Capitol Crescent Surface Trail. They'll connect you from where comes out by the dealership and basically take you a nice safe on route on Bethesda Avenue across Wisconsin Avenue. This will actually be a bicycle stoplight at Woodmont Avenue and at Wisconsin Avenue. It'll tell cyclists when they can cross Woodmont and when they can cross Wisconsin Avenue. So that's under construction. It should be finishing up this spring. And we just started the connecting project as Woodmont Avenue, so kind of on that southern end that will head up north to on Woodmont. Another projects in Bethesda area are Montgomery Lane, Marinelli Road up in North Bethesda is also going to be under construction this year, but that is also dependent on a Pepco project. We're coming in behind Pepco for that one, so that's schedule is a little in the air. Grove Street in downtown Silver Spring, that's one of the currently a temporary neighborhood greenways, and hopefully make a permanent solution for Grove Street. Other projects such as Cameron Street and Planning Place, Emery Lane, and Frederick Road up in the Up County. One of the biggest construction projects we have ongoing right now is what we call the White Flint West Workaround, or the Pike District Workaround, depending on which realtor you're talking to. If you're very interested in this project, there is a meeting coming up this Wednesday, the 10th, about this project, the detours. We're going to make the permanent closure for the existing intersection between Old Georgetown Road and Executive Boulevard. So if you're interested in have any concerns or questions about that project, there will be a meeting on this Wednesday night. And what this project is doing is basically creating a new grid structure for the Pike District, and also kind of making new alignments for Executive Boulevard and Old Georgetown Road in those areas. And not only is it a new alignment, but there'll also be new shared use paths, new bike lanes. We'll also have a separate project working on Rockville Pike outside there to make intersection improvements and make improvements along where the bus stops are and the sidewalk there to make it a much more pleasant experience getting between the White Flint Station and the Pike District. So that's only a couple of our projects. We have a full project map. Feel free to go to our website, it's montgomerycountymd.gov/vision0, and you'll see a link to a project map where you can go in and zoom in, click on things, see what's going on in your neighborhood. And if you click on a line or a dot, it will also take you to the project page if we have a project page for that item. So some other policy things that are going on right now. We have we call a 20 is plenty pilot. So we've identified 3 areas in Germantown, Wood Glen, and Long Branch that we're hoping to, in the spring, lower the speed limits from that are currently 25 down to 20. And we'll kind of use that as an experiment to see how the posted speed limit change by 5 miles an hour may affect travel speeds. We've seen this done in other cities where they've had a success at lowering the high-end speeders, the people who are really causing problems in those neighborhoods, having those speeds come down. So that's what we're hoping to do with this pilot. And if successful, we hope to expand it to a phase 2 and then further across the county. We're also working on an urban navigation study in the county with a pilot project to be developed within downtown Silver Spring. So this looks at all the different ways we can help our fellow residents who have low or no vision get around the county. And that will be, work is ongoing right now with that project. If you have any questions, let me know and I can get you information on this project and how you can get involved. And starting actually this Saturday, we have our next round of Vision Zero Youth Ambassadors starting. We actually have about 32 this year, which is one of our highest numbers we've ever had for this program. And this basically is a program where we train kids up on Vision Zero. They're high school age students, and they do their own campaigns basically by the end of the program on Vision Zero. As I mentioned at the very top of the program, we are working on our 10-year plan. I guess really 9 years at this point. We collected feedback from the public in the spring and summer. The work groups have wrapped up their work, and we're currently working on getting plan approvals internally from directors and the county executive. Our goal is by the end of March, if not early April, to have a draft out. I'll make sure to email you all to let you know when the plan goes live and how you can get involved. We'll have a survey like we did before, but we'll also do a series of public virtual meetings as well throughout the spring. And as I mentioned, we had our holiday task force before. We continue to do high visibility enforcement efforts throughout the year. So with that, thank you so much, and I will turn it over to our next speaker.
Great. Thank you, Wade. I think that I'm up next. There was one quick question in the chat, and how do you plan on enforcing some of the restrictions that are put in place under Vision Zero? And I think I don't want to answer on behalf of Wade, but I think the general answer is that the police department is very involved in this whole Vision Zero development process. And they're also working on some other things like automated enforcement initiatives and trying to put in more red light cameras and things like that across the county. And they've put out some press releases that talk a little bit about that. I don't know if you had anything to add to that, Wade.
Yeah, sorry, I was looking at the chat, making sure I saw the thing about restrictions. So, I mean, there are, at first I thought it was about COVID restrictions, but yeah, it was clarified about ticketing. Yeah. So one of the issues, one of the things we work on with our officers is always trying to say, we have this program called Focus on the 5, right? So if you're out enforcing, we want them really not looking for the behaviors that are most likely to result in serious and fatal crashes. So out there looking for impaired drivers, out there looking for speeding, out there looking for not yielding to pedestrians and bicyclists, you know, those kinds of things, distracted driving and not wearing a seatbelt, those kinds of things. And those are kind of year-round campaigns. And then throughout the year, we'll usually put out press releases or reminders to folks about upcoming events. So obviously next week being St. Patrick's Day, we'll put out press releases and social media about, you know, upcoming enforcement, but as well as ways to make sure people have sober rides for St. Patrick's Day.
Great. I wanted to talk just 1 minute about the PBTSAC and then bridge into the conversation about open streets. Over the past 6 months or so, the PBTSAC, the Pedestrian, Bicycle, and Traffic Safety Advisory Committee, has been very involved in sort of helping Wade put together the Vision Zero 10-year plan, reviewing some of the principles with Wade and giving our advice and input on those things. So we've been having some special meetings on that, and we just wrapped that up this past month. And I think that Wade is moving in a really great direction with this new 10-year plan, and we appreciate all the work that he and all of the community organizations that have given input into that have put in. Wanted to talk a little bit about open streets and both my own involvement in that as well as the involvement of the PBTSAC. At the beginning of COVID, I think there was a lot of comments from the community that people wanted to get outside and they wanted to use outdoor space as an option for recreation, and I think there was a general sense that people were fearful about walking along certain streets and wanted really more space to do things like take a walk or ride their bike and do it safely in a socially distanced manner. Wade mentioned streeteries, greenways, and all of those sorts of things that are under the county's shared street vision. And that sounds very familiar to what we in the Open Streets Coalition refer to as open streets. We see it as an opportunity for more streeteries, enhanced greenways and neighborhood permits to use streets and either close them to cars and allow pedestrians, or have arrangements where there is just additional space alongside of the street. Parkways, you all have probably seen some of the closed parkways and a few other special projects. So the Open Streets Coalition that was started by myself, Alison, Gillespie, and Peter Gray, who will talk when I'm done here, really was an opportunity to try to connect different parts of the community with people at MCDOT, with State Highway Administration and others, and provide sort of that community voice to allow those open streets activities to happen. And when we were looking at this, it wasn't just like, hey, let's close down every street in the county so that people can, you know, wander down the middle of every street. It was really thinking about where do we need additional opportunities for recreation? How can we provide additional opportunities for commerce, things like supporting restaurants through the streeteries, and also like providing areas around commerce centers to allow people to use the streets differently, and also connectivity. So recreation, commerce, and connectivity were what we really were thinking about when we were trying to target various areas in the county that we wanted to help advocate for more open streets opportunities and connect the community with the various government bodies. I think in general, the overall goal, in addition to those three things, were really to just find opportunities to get people outside and using their streets, and making the street usage safer for pedestrians, bicyclists, and motorists, really everyone who's using it. So it connects in really well with some of the Vision Zero principles and some of the projects that were already on the table. So with that, I'm actually going to turn it over to Peter, who's going to talk a little bit more about some of the projects that we've been focused on through this Open Streets Coalition.
Thanks, Kristy. So I'm Peter Gray. I'm the Vice President on the Board of Directors of the Washington Area Bicyclist Association. I'm going to put my email in the chat. So in case somebody wants to be in contact with me in the future, it's pretty easy. My first name at waba.org. One of the things that we have been trying to do through this Open Streets effort is to allow neighborhoods, well, we a couple of efforts. We have sent letters to MCDOT and to State Highway Administration urging them to take certain actions. So in the case of MCDOT, it was about this thing that maybe some of you have seen in your neighborhoods. Certainly in my neighborhood, there's a street, Woodland Drive, that has these big signs that say shared streets, no through traffic, with the idea being that the road in my neighborhood was sort of a cut through for people who didn't want to make the left at Georgia and Forest Glen. And so they designated Woodland Drive as a shared street. And it allows people to walk and bike in a safer manner as opposed to dodging cars going 40, 50 miles an hour. And I don't know if MCDOT is still allowing neighborhoods to apply for these treatments. Wade is saying yes. So there should be, if you just do a search for shared streets, MCDOT, you should be able to come on the website that sort of talks about all these different efforts that MCDOT is doing in terms of outdoor dining, the street there's the Wade put it in the chat. You can apply for a permit for a day, for a week, for however long you think it makes sense to put this kind of treatment on your street. And the best example of this in a sort of a more used context is inside the Beltway on Woodland Drive. It's a parallel street to Georgia Avenue, and you can go basically from Montgomery Hills all the way down to Spring Street on a road that before COVID was not particularly heavily used by cars, but now is even more pedestrians and cyclists using it. And there's some pictures that Wade is certainly being my straight man here to supply you lots of good information. The other thing that we did was we sent a letter to State Highway Administration and got a couple of other groups like Action Committee for Transit to sign on to it. And the suggestion that we made in that letter was to look at 19 miles of state highway segments to do possible interim or pop-up treatments that would give a protected space to people biking and walking. And I think I'll leave it for either Kristy or Alison to describe in depth what's going on, but there's going to be one of the first pilot is going to be trialed on University Boulevard between Arcola on the east to Amherst right outside the Wheaton CBD on the west. And it'll be provide a protected bike lane on one way on each side, and essentially put that stretch of University Boulevard on a road diet, slowing the traffic down and making it safe. The sidewalks are very narrow there. There's most blocks, there's no buffer between the sidewalks and the streets. We want to avoid what happened to 17-year-old Jake Cassell along Old Georgetown Road, where he was bicycling to the YMCA, and it was garbage day, and he was avoiding some recycling and garbage cans, ended up falling into the street and was immediately killed by a car. So we want to So we had this discussion with SHA, and to our surprise and joy, they responded very well, and the pilot is the end result of that. The other thing that I want to put in the chat is a link to the bicycle master plan. And so you saw in the slides that Wade presented that there were some projects that are already in process in various states of design, or as in the stuff in downtown Bethesda, in under construction. The bicycle master plan provides a very, very good roadmap based on very in-depth analysis of every street in the county, sort of gauging what the level of traffic stress is. What's the speed limit? What's the number of cars on that road, et cetera, to recommend various treatments, whether it's protected bike lanes or striped bike lanes or neighborhood greenways or something else. And on a lot of roads, you don't need anything, in most of our neighborhoods, which are sort of cut off from one another, sort of islands that are bounded by arterial county roads and state roads. Those roads are generally safe, but all these other roads to get from one point to another within the county need some help to make them safe. So I think I'll stop there. There was a question in the chat. Somebody was asking whether and I'm not sure which program, Karen, you were referring to, saying if it can be a permanent program.
Your state streets program, the idea of not having our street being used as a cut around to get that. We have a very narrow, very hilly, just a total disaster street, and people use it all the time to get around a no entrance into Kensington restriction.
Yeah, Karen, this is Kristy, and I put an answer in the chat, but Woodland and Grove Street are what are referred to as neighborhood greenways. Some of those are neighborhood greenways because there was a plan for that to happen previously. I think to the extent that there are good candidates for possibilities, there are several considerations that MCDOT goes through when they're assessing these things, but I think you should definitely feel free to make a suggestion into the shared streets email. I know that they read that, and Michael Paler and Hannah Henn and others at MCDOT take that incoming pretty seriously and are good about assessing things and responding, depending on funding and a lot of other things. Again, not speaking on behalf of MCDOT, but I think that would be your best bet.
So Karen, when we started this effort a year ago, the concept was that we were hoping COVID was going to be a temporary situation. But the idea being that these are all ideas that are in the bike master plan and in some of the neighborhood master plans, and we are hoping that we can make these things in the form of these greenways where there are actual incentives really for pedestrians and disincentives for cars to use certain stretches of road as a through means of transportation so that it's safer for people to walk and bike. And so a diverter where, it's a through street, but there are examples of this in Bethesda where Leland Road right by the Jane Lawton Community Center, if you're coming from the east, from Connecticut, you get on Leland, you come up to a point in the road where bikes and pedestrians can go through, but the cars have to make a left or a right. So it just teaches the drivers that there's better ways to get around and allows it to be a safer mode for people who are not in cars. The other thing that I want to mention, and I don't have a website to point you to, but if you're interested in that, interested in this, try to remember to follow up with me. There's a group that started in New York called Families for Safe Streets, which basically had a combination of people who were impacted with family members either being killed or severely injured in crashes with cars, and people like myself who were active transportation advocates. And it's kind of a two-pronged approach. One is to give support to these families. Miriam Schoenbaum, who is actually on this call, has sort of been spearheading doing memorials and putting up either ghost bikes or ghost shoes at the intersections where pedestrians and cyclists have died, and doing outreach to families and trying to give them support of one means or another, but also to gather that energy of the families and the other advocates to push for changes in the way that the roads are being designed and built a la Vision Zero, so that we can all arrive maybe even in less than 10 years at a point where nobody is dying or being seriously injured in these crashes. So this is something that was sort of launched, announced at Councilmember Glass's town hall on Vision Zero, and there'll be more activity sort of showing up in the public spaces in the months to come. So I just want you to look out for that. And if you know people who have had family members or close friends who were affected by crashes, you can point them in my direction as well. So I think I will turn this over to Alison, my neighbor, and she's going to talk about some of the stuff we've done in our neighborhood and also what's going on University Boulevard.
So knowing that a lot of you are civic leaders, I'm president of my community association, which is just near Holy Cross Hospital. And as Peter mentioned, we've long had a concern about this one cut through street. Sounds very similar to Karen's situation, where it's just always been sort of a problem street in the neighborhood. The DOT, I wanted to clarify because I see a lot of questions in the chat about this. There are two sort of branches to the DOT program. One is the streets that are being converted into like routes, and those are lifted directly out of the bike master plan. And it was really, really, really great to have that bike master plan finished before COVID, because it literally was a roadmap to where some of these problem areas were. But DOT very wisely, actually, credit really goes to Hans Riemer for this. Because right at the beginning, literally almost to the day a year ago, Hans and I had a long conversation, and Hans had this really great idea that if you can get a block permit, if you can get a permit for block parties, why could you not get a permit for having a street shut down for a short period of time, a few days, and not completely shut down, but just made into a slow street. And Hans, I thought that was a really good idea. And I know DOT, kudos to them for being open-minded to that. And Wade, I saw you nod earlier that you all are thinking about doing that again when spring comes. I think during the winter, that kind of slowed down a little bit. But as far as I'm told, right, Wade, you guys were thinking about doing those temporary ones again. Is that true?
They've been going actually throughout the winter. So if anyone wants to, if you go to that link on the shared streets, you can apply. Those are largely, you kind of pick like a long weekend or during the week to have a shutdown. But you sign up and then we get in touch with you about, one, to verify that it qualifies, and two, what dates would work for your community.
And so then it becomes with some signage, and some of them have been little short distances, but they've had a huge community impact. I know that near Grove Street, that neighborhood in East Silver Spring had all kinds of ice cream parties at the peak of summer when nobody could go anywhere. And they drew circles in the closed street and said, stand this far apart. And they had an ice cream truck come, and the adults paid for the ice cream. So it was like free ice cream for the neighborhood. And it was really something that kept everyone's spirits going. We had some other people who, like, they would have like hockey, street hockey in the evening, and the closed street allowed them to do that. In my neighborhood, we had the more long-term, as Peter said, Woodland Drive. And I do want to tell you, that has been really magical, because that street was dangerous, very, very dangerous. And because of the barricades being put up, it really slowed traffic down. And My one friend, one day I was in a conference call and I got a text and he said, I'm here with my 5-year-old and 3-year-old in the park and I just watched 5 families come in 20 minutes on a street that nobody could have ever really felt safe riding a bike on before. They all arrived. The whole families just all came on that street. We've also had kids out, you know, roller skating on that section of street because now it's actually safe to do that. And one of our neighborhood board members actually started crying, telling the story because she lives on that street and she always felt like it was really unsafe. And she said it's been transformed into like a totally different kind of street because of the shared streets program. So it's been really good. It's also had come with some pitfalls though, I will say, as neighborhood president, since again, I know a lot of you are fellow leaders of neighborhoods. It made people on other streets realize that they had problems. It kind of was like, hey, wait a minute, over here we've got a problem too. And we want, you know, we want some attention to that. And we've kind of funneled that energy into getting those folks now to be advocates for the problems on their street. And what you realize is, as my one neighbor said, the real solution is to get less people driving, is to get less people on the road and to get people out of their cars. And if we could all just be biking and walking more, then we'd all have safer streets. And so it was kind of an interesting sort of dynamic that happened in our neighborhood. The last thing I'll say, because I feel like there's a lot of questions that are coming up and I see some that I can answer that have come up in the chat, but I do want to give my a tip of hat to Evan Glass, because he has been such a tremendous supporter of Vision Zero. And he has really put a lot of effort into keeping the focus on Vision Zero. So kudos to him for that. I think that that's been tremendous, and he's really made it a big difference there. So somebody asked about Little Falls. So we have these 3 open parkways, and we also need to give a hat tip to the Parks Department, because the Parks Department has had real vision and been very out front about saying, yeah, this is good. We should give people more space to recreate. And you know, I think Casey Anderson and Mike Riley as leaders really put themselves out there and said, we're committing to this. And that was great. So we had Sligo Creek Parkway is closed Friday, Saturday, Sunday, parts of it. And Beach Drive is closed Friday, Saturday, Sunday in our section. It's closed 7 days a week headed into DC. And then Little Falls was closed in the fall. During the winter, Little Falls, they stopped the Open Parkways program. We are hopeful, or I should speak for myself, I'm hopeful that in the spring that can restart, but I think there's, last we heard, they were still deliberating. And I think if you have some feelings about that, there's no harm in letting folks in charge know, your council members or whoever, know that you would like to see that happen. So if you want Little Falls to be an open parkway again. But those programs have been fantastic. That again has transformed a lot of things. I've never seen as many people roller skating in my life. And you go out on a Saturday when it's 30 degrees outside, and there's people roller skating, and old-fashioned roller skates, not inline skates, but I mean the kind I used to ride in 1982 in 7th grade, or use in 1982 in 7th grade. So I think that's been fantastic because it's really opened up a lot of possibilities for people. Were there any other questions from the chat or any other? I think at that point I'll stop talking and we'll go to questions. But see,
Alison, there was a question from Carrie about whether or not the neighborhood greenways cause other cut throughs or other traffic patterns, and are those being monitored?
Yeah. So I will here tip my hat to.
Yes.
Well, I would say I'll tip my hat to. Okay. Well, are you going to answer it, or do you want me to, Kristy? I can.
Go ahead.
Go ahead, Alison.
Because we probably both know. Then Peter, I was going to say hats off to Wade's office, because I think they've done a lot of that monitoring and been very sensitive to that issue. And I'm getting a message that my connection's unstable, so maybe I should let Kristy take it from there. But I will say,
yeah, I would say, since you're breaking up a little bit, Alison, this was a big concern, I believe, in Peter and Alison's neighborhood when they implemented the Wyndham shared greenway. And Peter, I don't know if you want to talk at all about that, but I think you came up with some solutions to that.
Yeah, on Woodland, there was the cross street is Tilton. And so Alison knows a little more about this, but basically what happened, which I think heartened a lot of the people on that road who suddenly saw an increase in traffic, and of course during these times, any increase probably is more salient than it was before COVID hit. But they were happy that that Alison and the leadership of the community association engaged with those people who were unhappy about sort of the collateral effects of closing of limiting the traffic on Woodland, but also MCDOT engaged in a way that really made people feel like they were being heard. And I don't know if you want to add anything more to that, Alison.
Yeah, I think that that gets to the point that it really, from our neighborhood, I think it brought the conversation forward about what, so is it moving? No, did shutting one street cause a problem for another street? And at one of our neighborhood associations, we had a really long conversation about this. And I think it really helped raise the visibility of the problem overall. I think it is potentially can be a problem, but I think overall, my reaction to that is that overall the program, I think, really works well to address traffic flow in general, because DOT is using the greenways that are outlined in the bicycle master plan. So I don't know if I think that answers the question.
Bailey, you have your hand up. Did you have a question?
Yes. So there's a long road in my neighborhood, Parkwood Drive, which parallels Beach Drive, which gets closed on the weekends. There are serial offenders who fly down Parkwood Drive and they blow stop signs on a regular basis. So is there a police contact for each district that people can call to ask for increased enforcement? And this is not something that would cost the county money. This is a money maker. If they put 2 unmarked cars at this certain intersection, they'd make close to $1,000 in an hour. And they would really give people the impression that they're not going to tolerate this kind of reckless behavior anymore. And in the mornings, a lot of these people are parents taking their kids to school.
So I will say one thing about that. There are places near my kids' schools that are similar. And we have petitioned over and over again to have cameras. People are begging for more cameras, and the limit on the number of cameras is an issue. There is a red light in our neighborhood right next to a middle school that people blow through, and I'm surprised we haven't yet had a fatality on the way when kids are on the way to school there. And I really feel strongly that this is me speaking personally, I think we need to really think seriously about more camera-based enforcement, but I think other people might have other opinions on that.
Yeah, thanks for the question, Bailey. Can you repeat the location? I can see what district you're in. Yeah, so every police district has, we have a centralized motor unit that's based out of the Gaithersburg office. And also all of the 6 police districts have their own motor units as well. So when they get traffic complaints, they'll go out there. There's a couple different things we can do in these situations. One, sometimes we can put out, the speed feedback signs up front first, saying like, hey, slow down. And we'll do that kind of first if there's space to put something like that out there. And like I said, in-person enforcement, as well as if it's approved location for a speed camera, speed cameras can be moved into those locations.
Yeah, the location is Parkwood Drive and Saul.
Parkwood Drive and Saul.
So that intersection, if you take a left at Saul, you drive 250 yards up the hill and you're at Parkwood Elementary School. So this should be one of those safe routes to school intersections where this kind of behavior just shouldn't be tolerated. And at each of those intersections around that elementary school, it should be the same situation. But I know it all costs money.
So Bailey, I don't know if it applies to your situation or Pete Salinger raised the same issue. I think that it certainly is worth bringing this to Wade's attention and to elected officials' attention, because you can look on the Vision Zero website and see when actual crashes take place, but what they don't and can't measure is the near miss factor. And
Yeah.
so I think that certainly, again, I'll, put my head out there. If you're trying to do these kinds of means of outreach and you're not getting any traction on it, I'm happy to add my name and efforts to that. But I think that the sort of the overall goal has to be that, and there's a lot of this intersection by intersection kind of work that is done in DC, mostly by the DC chapter for Families for Safe Streets, which is supported by the Washington Area Bicyclist Association. But hopefully we'll when we sort of get the Montgomery chapter of Families for Safe Streets up and running, we'll be able to mount those same kinds of efforts. Sometimes police enforcement is the answer, but more often I think it's remake the road so that people cannot do what they're doing. And that means hopefully we'll be able to sort of apply this 20 is plenty strategy countywide as much as we can. They're doing it in DC, they're doing it in other cities in the US, and making the expectation of drivers adjusted so that, like in downtown Wheaton now, you're going up Georgia Avenue, from my neighborhood, you have to slow down to 25 miles an hour instead of the speed limit being 35 and people often going 40, 50 miles an hour. So I think we need to adjust drivers' expectations. That's certainly one way of doing it. But then also there are other traffic calming measures that can happen. And the fact of the matter is, when we do this pilot, and hopefully it'll start before Memorial Day on University Boulevard, taking out a lane of traffic on that street will slow the traffic down. And I know that is something that upsets a lot of people who are driving longer distances, but we need to make a calculation in terms of, and I'm hoping that is shifting to a point where I started to get involved in this stuff 15 plus years ago. The only thing that DOT was looking at was traffic throughput. But now we have to shift the culture and say, that's not the most important thing. The most important thing is that everybody gets to where they're going alive, whether you're walking, biking, driving, whatever it is. So I see some hands raised. Jerry Garson, you want to ask your question?
My question is, can we have every crosswalk in the county be painted or equivalent to alert motorists of pedestrians crossing? If we can't do every street in the county, can we do every street near every public school or a private school to alert motorists of people crossing?
So I have to tell you that Kristy and I serve on the MCC PTA Safe Routes to School Committee. I was the chair until just a couple of days ago, and we both have served in that quite a bit. And I do want to throw out a piece of legislation is actually currently making its way through the House, or no, through the state legislature, and has gone on to the Senate. It's introduced by Delegate Solomon, and it would require, when school construction is done, very early in the process, to have these kinds of pedestrian things be put into the plan for construction. So they wouldn't be able to get construction approval without doing a pedestrian plan first. And right now, there's a tiny bit of that done. It's done at the end, and it's often somewhat honestly, somewhat haphazard, in my opinion. This would put it really early in the process and would require a much higher level of concentration on it. So if anybody has, we really need some support for that, reach out to your state senators, because it would be statewide. And I think it would get it to a lot of what you're talking about, Jerry. I think Kristy might have some other thoughts too.
Yeah, I mean, I think, even just having people better understand what constitutes a crosswalk would be a helpful starting point. I am not MCDOT. I don't know the feasibility of marking every crosswalk and everything like that. I think before we start marking every crosswalk, we need to get the crosswalks that we do have up to snuff. I mean, there are still crosswalks in the county that are not marked in the right way to give, ultimate visibility. I don't know what Wade's thoughts are on that. I mean, you also have the issue of, you're not just talking about county roadways, you're also talking about state highways. I think that the crux of your point, though, is that we need to make it so that people have a better sense of, what's happening on the roadway around them. Part of that is slowing down traffic to some degree, allowing easy places for people to cross the street, making sure that where people are crossing, that, drivers and pedestrians can both navigate that space in a good way, providing more visibility. I mean, there are a lot of different interventions, even in addition to, marking a crosswalk. It's using the tools that we have in the toolbox, various signals and signs and, paint and all sorts of different interventions.
I've got a question. My question's on outreach to communities that don't speak English as their primary language. A lot of the fatalities have been people from different language communities. What's the county doing to do pedestrian education to people who speak Spanish and French, Amharic, and Korean?
Yeah, that's a great question, Alan. It's something that we always want to work more on. I really wish we had, we don't have as much staff as we would like to speak those languages fluently. Sometimes we do lean on our partners, as Dr. Gayles mentioned, Office of Community Partnerships, the HHS, Minority Health Initiatives have been great partners as well, helping us do outreach during COVID. We're also sponsored over the summer as part of the Vision Zero and the climate action planning process. We had some students and some focus groups that were, spoke Amharic, that spoke Spanish. I believe we had one Mandarin speaker as well, that helped us do some additional outreach for people who spoke or are more comfortable speaking language other than English. We hope to teach some of those things going forward.
And this isn't probably the budget year to do it, but next year we should be pushing for Wade to have more staff and for MCDOT to have more effort staff-wise behind Vision Zero. So I see hands up from Sue and Jeff and Karen. So if you could go in that order. Sue, you're first. But you have to unmute yourself. Sue, you're not there.
Okay. Okay.
Yep.
All right. Little Falls is parkland, and the Parks Department at our last meeting of CCCFH, Citizens Coordinating Committee on Friendship Heights, the Parks Department said that's their land and they'll open it, and we have no say whatsoever. Of course, we're very rich neighborhoods and we're taking them to court.
Well, I think that, I don't live in your neighborhood. I'm very familiar with it. I was the chair of the Coalition for the Capitol Crescent Trail, which draws a lot on people from your neighborhood, both in support and in criticism. But certainly you can compare what happened with Little Falls with what happened with Beach and Sligo, and you can see that your neighborhood, in fact, was heard. And so they reopened the streets. Now they're considering some treatment that will either be a revert to what it was or just have a partial closure. But again, you know, it's not that Parks doesn't listen to the neighbors around the streets that they go through. Certainly, I would prefer that Sligo Creek Parkway be closed all the way from University down through Tacoma Park. But that isn't what Parks has done because they're responding to people in the neighborhoods. So, you know, that's my response to that. But, you know, the head of Parks is Mike Riley, and he certainly has an email address, and you can let him know what you think. Jeff?
Thank you. Quick question with regard to the situation that Bailey described earlier, which we have discussed for many years. Is there any option for the local residents association to pay for a speed camera which could issue tickets? And how much would that be?
I put an answer in the chat in that there's some pretty tight restrictions on the automated enforcement program in the county. There are only certain numbers of automated enforcement, you know, cameras that are allowed, and there are requirements for where they can go. Maybe Wade can talk to this, but I don't think that it's allowable for residents to buy a camera that issues tickets. I don't think that that's part of the program that was as it was conceived.
Well, I understand that, but what's the county position? Why, if people will donate money to the county to provide the camera, what would be the objection?
So sorry, I was looking at my list to see if your road's already, so what you can do is, because there's a school, I'm not sure exactly all the rules around there, but it looks like you're close up to a school, right?
Yes.
So, have you ever requested MCPD to?
We have, and they periodically show up, and because there's not a permanent thing there, and because they don't show up permanently, then as soon as the drivers figure out that they're not there any longer, the problem resumes. If you have a permanent camera there, then people learn to slow down.
So currently there's a certain number of cameras that MCPD will put out. And this is something that my neighborhood has certainly pushed back on quite a bit. That's my response to that. The number seems to not, we can't get real information on why they sort of arbitrarily picked that number. I know that some of the county council members, and maybe I don't know if Evan's still with us, but this might be, I don't know, but I know certain county council members have indicated that they have seen a big culture change. That years ago, if you talked about cameras, nobody wanted cameras. Everybody said, oh, they're just trying to get money from us. There was a lot of pushback and anger about speed cameras and red light cameras. And now everybody seems to be wanting a lot more of them. And so I think that's a culture change and one that you can keep pushing. And I would say asking elected officials, why does MCPD or the state, in the case of George Avenue near my neighborhood, why do they have that number in place? What's the justification for that number? How can we get that number higher? How can we get more cameras? We would like to know, why did you choose that number? Why is it only these? And why do you have this quota? Who sets that quota? These are the things I would push on more than money. And here's why, because I think it's an equity issue. Because we can't, right now, the places in this county where people are killed the most are the poor neighborhoods where there are a lot of people of color who depend on their feet to get to work. They depend on getting to work, using their feet to get to the bus. And we need to keep equity on the front burner. But I think that equity is a good question to ask when you're asking about speed cameras and red light cameras.
Well,
So-
I would just go to the basic question. It's really,
Yeah, I
it
know.
sounds to me like it's a political will issue, not so much. If there's an automated camera, the whole process could be automated. So what you're suggesting is that
There are
what it
bills.
really is about whether the political folks have the will to do what needs to be done. And if we could do it in the richer neighborhoods like mine, there'd be more county money to put it in the poorer neighborhoods where they don't have the money.
I wouldn't speak to the money
Well,
part, but I think political will is a big part of it.
Yeah, and I think like a lot of this is based in state law. And so I think, working with, you mentioned Jeff Waldstreicher and some others, like working with your state representatives to get this fixed would be helpful. There's also a bill to move or to allow the county to assess whether or not automated traffic enforcement should move from the police department into the Department of Transportation. That's another thing that you should check out.
Thank
Because-
you. The irony is Jeff Waldstreicher lives on Parkwood Drive.
Yeah.
So enough of that. Thank you very much. You've answered my questions. I'll start writing letters.
So one last question from Karen Cordry. Karen, you still have a question?
Yeah, it's a real quick one, which is, do you all have any authority over sidewalks and so forth within like malls? My neighborhood, Kensington Heights, we surround the Wheaton Mall, and thank you for all the things you're doing out on the Triangle. But all of that area around the south and west side of the mall, there is no sidewalk anywhere there. You have to walk in the roadway, literally. And the only thing I miss about the Costco gas station not being there is that would have given us a sidewalk, which they didn't put in when they didn't put in the gas station. So is that anything you all have any control over, or is that we're just stuck?
And I think that's a question for Wade.
Yeah, Wade, that was your
Yeah.
question.
Yeah, Karen, before I answer your question, I want to go back to the cameras. So yes, we have a more basically approved sites than there are cameras in the fleet. The fleet is largely limited by, our current contract. We hope with the next contract, which we hope to release in the next couple of months to have approved, we'll have more cameras in our fleet to allow us to go to more sites that are approved. We have I think less than 50 automated cameras that can move around and a couple hundred sites where they can actually move to. So we hope to have more. So it won't be permanent at any places, but it will be more frequently to more locations where they're approved currently. So into your question, Karen, no, if it's a private property, we don't have control over there, but I've heard rumors that Westfield Wheaton may be under redevelopment at some point, at least that whole parcel. So that would potentially change that whole area quite a bit.
Well, that's interesting. I'll give their management a call or an email and see if we can find out what's going on, if there is anything in process, because that would be nice. It's hard to get people to want to walk to the mall if you have to, take your life in your hand while you're walking there.
Oh yeah, I used to do when they had the second bridge, I used to do like up and down the bridge from the metro all the time. So just to avoid going across the street there.
Right.
Well, and let's be real, it is a huge walking pattern, watershed from the Wheaton Metro to the neighborhood. And it should be something that we can work with the mall on to help put a little bit of pressure on them to make their property safe.
Right. Well, when they let the Costco build with its wall literally 1.5 feet from the street, somebody wasn't on the ball there, so.
I'm with you, Karen, because it's only a mile, 1.3 miles from my house to ride my bike to the Giant, but it is one of the hardest 1.3 miles you can imagine because most of it's through that parking lot. But the shared street that I use to get to the parking lot has been great. Thanks, DOT, for putting that in. But it's still, I end up at the Westfield and it's like, whoa, this is bad.
So that was the last question and the last answer for tonight's program on pedestrian safety and open streets. We want to thank our wonderful guests, Councilmember Evan Glass, Wade Holland from the County Executive's Office, Peter Gray, Alison Gillespie, Kristy, Daphnis. Did I forget anybody? No, I think that's it. It was a great program. pedestrian safety is one of the priorities of the Civic Fed, and we're going to revisit this conversation often. So thank you all for joining us.
Thanks for having us back.
Absolutely. Kristy, who is an award winner from the Civic Fed's, she's got the Sentinel Award for the great stuff that she's done for pedestrian safety. So thank you.
I always enjoy talking to you all. Thank you.
Nice to see you guys. Hopefully we'll be riding bikes together and
Soon.
on the streets. So thank you guys. Is there anything we can do to get your information out to our communities? Please let us know. If you'd like to write an article for our newsletter, always open to those kinds of suggestions. So thank you very much.
If you're on Facebook, join our Facebook group, Open Streets Montgomery. It's a pretty active group.
Thank you very much, Alison. And we'd love to get Forest Estates to join the Civic Fed. Okay, everybody, we're going to, well, let's see how many people here will go to the gallery view and see how many of you are still here. There's a good number of people. We're going to conclude with some committee reports and some announcements. I've got a list of committees. If you've got anything you want to offer up in terms of education, this is a time to say something about that. Anybody want to say anything about education as our numbers drift off? Environment. Bailey, would you like to say anything about the environment?
How did you know I'd say something about environment? All right, so there's a group of scientists called Facing Future, and they are all over 5G. So the media has sort of swallowed this hook, line, and sinker. The media keeps painting 5G as the technology of the future, but it's invading the public domain without public oversight. The costs are huge. Operators have recently paid 1.4 billion pounds in the UK for 5G wavelengths alone. So we've got the pandemic, a debt crisis, climate breakdown, and economic collapse. How does it make sense to throw so much money at a potentially harmful tech fantasy when we need to spend billions on green transition to sustainability? So one of the other points they make is that it's estimated that the information and community technology sector is going to consume 20% of global electricity production by 2025. That's up from 3 to 5% in 2015. And this is just feeding an incessant addiction to phone screens. And scientists at the UK Royal Society found that streaming a single HD video on a phone generates 8 times the carbon emissions as streaming in broadband, with no real difference in clarity. So I'll go back to the original point that this is all happening without public oversight. And if they get to do everything they want to do, they're talking about having a 5G transmitter in residential neighborhoods every 5th home. So that's how much radiation is going to be bombarding all of us in a very short period of time. And they're now talking about putting 50,000 satellites into space to make all of this happen. So just food for thought.
Yeah, we don't need any food for thought. We really need some policy suggestions for the group. So I'm not sure if you're suggesting something.
Well, we've been engaged with the 5G rollout that our good council member has tried to take local zoning prerogatives away from us. So I say we keep fighting to have zoning kept as a local jurisdictional public policy.
Okay. We could also talk environment, is that Civic Fed signed on to a letter by the Climate Action Group Coalition. What is it called, Bailey?
The Climate Mobilization Coalition.
Basically suggesting that there's more work to do and asking for the county to come back with a more detailed plan of implementation and budget recommendations for the community to consider by Earth Day.
Yeah.
We're also following very closely the debate between stream restoration and stream destruction. And we had Ken Bauer write a letter about stream restoration, the preservation of streams in the March newsletter. So thank you, Ken. And please, Barbara, if you're still here, tell Ken that we appreciate that work. Land use and planning. Do we have anything we want to say about that? Well, then let me take this opportunity. Yeah.
Hello.
Hi.
Hi. This is Harriet. I just wanted to add, after what Bailey was mentioning about the 5G, that tomorrow the Fed committee will be discussing ZTA 1907, and that is the old ZTA that proposes to put one of those antennas on possibly every telephone pole in your neighborhood if you have above ground utilities, and then add new poles to those neighborhoods that have below ground utilities. We have testimony that's on our website that we opposed that ZTA, and there are a lot of other groups who are also opposing. So I'll put a link to the staff report in the chat if anybody is interested tomorrow morning.
Thank you, Harriet.
And then I think you probably have a report on missing middle, Alan, so I'll leave that to you.
Yeah, I was going to go there. So just an announcement that we changed our program schedule. So we will be talking about missing middle housing at our April meeting with representatives right now from the planning department. That's an issue of great interest to our neighborhood. So we're going to have that conversation. Moving on, legislation. I don't see Peggy here. You might note in our March newsletter, we identified some pieces of legislation that we thought are particular interest to neighborhoods. And one is a bottle deposit bill, which is making its way through the legislature. And we don't have one in the state of Maryland. A public safety.
Hey, Alan, one quick point before we move off of land use. There apparently is a new ZTA that just got introduced today, which would greatly expand some of these issues. And I think it's actually Hucker and Reamer, I believe, introduced this, and it will be considered, I guess, along with the other ones. So this is very definitely a moving target at this point.
Is it a new ZTA or it's a recommendation for planning to come back with another plan? I think it was a press release from Hucker and somebody, Reamer, I guess.
Reamer, yeah.
Alan?
Let me see how to.
Hucker asked.
I'll do the other one and I'll come back to you and tell you what it.
I'm looking at it now. It says Hucker asked planning to consider additional ZTA proposal on missing middle housing.
Well, what I saw was a very detailed, very complex actual proposal there. So I think it's.
No, it's in that email that came out.
Alan?
Yeah.
Okay. I didn't want to interrupt. I never got invited to that. You said there's a group that's looking into it for the Civic Federation, missing middle, ZTA 2007, and as well as Thrive Montgomery. I really think the Federation needs to have a committee of some sort, and I'd like to participate if possible. We've got to get moving because this is a train that I think is heading for a wreck. And if we don't speak up, then we're gonna get what we deserve, I guess. You know what I'm saying? I don't want to just. It seems like the last couple of months we're just saying, okay, missing middle's coming. We'll deal with it later, and we've got another group involved. I'd like for us to have our own committee, and if at all possible,
We'll take that under advisement. We have the executive committees, next Thursday. And as I said, we did revamp our schedule to take up missing middle as a Federation issue next month. So we'll have lots of resources on that. And we will add you to any group that we put together.
Appreciated, but if you wouldn't mind considering prior to next month, if we could have a small group. I know Karen Cadre is very interested in this. I'm interested in this, and many others are. And I think if we talk it out, we may be able to have some recommendations ourselves within the Federation. That's all I have to say.
Okay, thank you very much. Okay, public safety, point of personal privilege. I'm the president of a group called Safe Silver Spring, and on Wednesday night at 7:30 via Zoom, we're going to have a community conversation with the Montgomery County Police Department. We'll post information on the Safe Silver Spring page and the Civic Federation page. If you have any questions you'd like to ask representatives of law enforcement, that would be a good time to do that. I don't see Lewis here for public finance, so we'll skip over that. Jerry Garson, something on transportation?
Yes. I've been working with State Highway Administration on problems of, we've had numerous tractor trailer accidents, more than one a week on the average. And I was pushing them to come up with a solution. They did come up with a solution, and they've been putting abrasives on the westbound I-495, the Beltway, from Georgia Avenue to just past the bridge over 270, where that whole stretch, because of all the curves, there have been numerous accidents of tractor trailers, often late at night, blocking the Beltway for hours, and then basically diverting traffic to every local street. So they've been putting these abrasives in. Most people wouldn't even notice it unless you're aware that they put them in already, and most of the lanes have been completed. There is a public hearing that I spoke at this morning, objecting to the WMATA's proposal to basically shut the Grosvenor station and reduce the amount of service to every station outside the Beltway on the Red Line to once every half hour, which basically would lose a huge amount of revenue they do in the parking lots. And they're going to have more public hearings on it on Tuesday, on March 9th at 6 p.m. and again on Wednesday, March 10th at 6 p.m. You can sign up. Very few people want to actually speak on the proposal to basically get rid of most of our rail service in the county. I mean, if you got to wait every half an hour for a train, most people are not going to take trains. And they also want to eliminate a significant number of bus lines, including all of the Q series, so there'll be no more WMATA bus service on Vias Mill Road. I think this whole thing is a major mistake. We had a meeting with our local civic association, because we're really fairly close to the 270, and they had an interesting discussion with charts and what they're going to do. And I've discovered that most of the entrances to these high occupancy toll lanes are not going to be in the lower part of the county. In our case, there'll only be an entrance on Westlake Terrace and one on Wooten Parkway in the lower part of the county. So basically, this whole plan for high occupancy toll lanes is not for the lower part of the county. But in the discussions, they admitted that the initial first part of the project between the American Legion Bridge and 370 will not be completed till 2026. So I think the people who are very concerned on the eastern part of the Beltway between 270 and I-95 shouldn't be too worried, because this is really years and years off before anything is going to happen. Does anyone have any questions on transportation?
Thank you, Jerry. I want to recognize the three past presidents, Bailey Condrey, Dean Ahmad, and Carrie Lamari. Thank you for being with us. Nice to see you there, John Wetmore, and nice to have you, Barbara Hoover. I think that's it for this evening. Anybody have any other announcements for the good of the order before we adjourn? I want to thank Danielle Terrelong, who is joining us this evening. She's the owner, proprietor, the president of Buzz365media.com, Buzz365media.com. They're live streaming this Civic Federation meeting to Facebook. You'll be able to see the live feed on the Facebook, on our Facebook page. So we would like to do more of that in the future. So thank you, Danielle, for the technical assistance. We hope you see you Wednesday, and entertain a motion to adjourn.
I so moved. Sue Schumacher.
Second,
Second,
all in favor?
Aye.
aye.
Thank you, guys. See you next month.